For over 30 years, the team at Hope Store New Beginning Center, along with our clients and community partners, have been building lives without violence in Dallas and Collin counties. If you are in immediate physical danger, please call 911. If you need shelter or would like to talk to someone about receiving our other free services, please call our 24-hour hotline at 972-276-0057 in English or Spanish. At Hope Store New Beginning Center, we offer free trauma-informed services for those affected by domestic abuse, battering intervention and prevention services for those who have abused their partners in the past, and free community education services for any community group or organization. Domestic abuse is a human rights issue that affects a third of all Texans. We empower victims, perpetrators, and community members to live in safety and foster healthy relationships. Please call our 24-hour hotline for help or visit hdmbc.org to learn more about our services. And don't forget to follow us on social media. Hope Store New Beginning Center, building lives without violence.
Hello, everyone. Thank you so much for joining me today. So unfortunately, for some reason, my camera isn't working, so that's why you aren't able to see my beautiful face on the screen. But we're going to go ahead and just push forward. Technical issues happen, so what can you do? But my name is Jose Romero, and I'm one of the bilingual community education facilitators at Hope Store New Beginning Center. And today we're going to be covering the topic of the stigma of substance abuse among victims of domestic violence, which is a very important topic. And we're going to discuss some of the things, some of the harms that come from that stigma when clients are trying to seek services. I'm going to share some of the stories that I've seen, that I've encountered from previous jobs and even in this current job that I'm at. So it's all learning experiences and just information that I've gotten from clients that I want to help share with individuals that might be watching today, so we can address those concerns of stigma that might arise in situations, so we can help erase some of those stigmas that are out there when some of these substance users see it in the front line when at agencies. So that's what we're going to try to address today. But that introduction video covered most of our the resources that we offer at Hope Store New Beginning Center. And at the end, if we have some time, I'll go more in detail into some of those as well. But I am part of the education department, and what we do in our department is we promote healthy relationships and empower community members of all ages to understand, prevent, and respond effectively to all forms of abuse. Now, in our line of work, we know that prevention is key. We don't see it immediately. There's not one particular thing that'll say we did our job effectively then and there when we do our presentations or our webinars in front of individuals. But being in this line of work, you do get those thank you notes. You receive emails from past clients that reach out to you, which makes you feel good when you get those messages, those positive messages that show you that you are making an impact with your line of work. So I'm very fortunate to be able to do this for a living, and current events with COVID-19, it has affected the number of members we're able to reach with our message to help educate the community. But we're doing our best, especially with these webinars, and this is the next best approach that we have when it comes to educating the community. And just a reminder, there are CEUs available for this webinar, and if you need webinars, we're going to have a follow-up survey at the end of this presentation, so you're going to be able to fill that out if you do require those CEUs. And we're going to talk a little bit about the roadmap before we get started. And I also wanted to give a quick disclaimer, because a lot of our presentations have been friendly for youth and for children to watch. And this one, just like the one I did previously, has a bit more topics when it relates to opiates and just substance use. So I just wanted to put that out there before we get started, before that conversation gets going. So just a quick disclaimer, but we're going to be talking about defining some of these terms that we're going to talk about today, because there's probably going to be a few that maybe you have heard of, maybe you haven't heard of. So I'm going to make sure we're all up to speed when we start talking about this, so no one's left behind. But we're also, I'm gonna, if you've been in my webinars before, you know I love telling stories and sharing experiences. So I have more of those to share, and just I enjoy sharing those because it lets you know that that the impact we're doing with our community is actually working. So it's just something I enjoy to add into my webinars. But we're also gonna talk about the harms that come from this stigma. Like I mentioned, we're gonna talk about resources that are available and why the stigma actually affects those resources, because it acts as a barrier when clients and victims are actually trying to access those resources. So we're going to discuss about that as well. But we're also going to talk towards the end about how do we actually reduce that stigma so that these victims and clients aren't having to face added barriers on top of what they're going through at the time. And specifically today, we're also going to focus on victims of domestic violence who are the substance abusers. So not their partner, not their abuser, but them themselves. So we're going to talk about how it is a co-occurring situation where they have to deal with abuse, but then they're also the ones who are the substance user in this situation. So just to get started with our webinar, I wanted to give a quick, just my beginning story, just to get it right out in front. So there was one situation where I gave this presentation, or it was an earlier version of this one, but I gave a presentation at a substance use facility, and there was this lady. She was just sitting in the front row, and she was going through her text, or her cell phone, and she was going through her text the entire time I was giving this presentation. And I didn't say much of it. I've learned to never call people out like that, because there might be something going on behind the scenes that you're not aware of. So at the end of the presentation, this lady came up to me and she showed me her cell phone. She's like, everything you covered, all the abuse, all the forms of physical abuse, emotional, financial, I've gone through that. And she asked me if I had a second so we can talk. And I said, sure thing. So we're sitting there and she's showing me these text messages. And you can see her perpetrator is blackmailing her. He's using pictures that they've shared between one another as blackmail to use against her. You see a lot of verbal abuse as well. And it was just constant text that she was showing me. But what followed was pretty much her telling me that she had tried to get jobs, but every time she went to the application, fill it out, and then she got called up for the follow-up where she had to do a drug test, she would automatically fail because she was using substances at the time, and she would be turned away from that job. So there we were seeing that she had no income herself, so she was highly dependent on the income that her abuser was making. So she was being financially abused there because it was him threatening her with a place to stay, or to kick her out so she wouldn't have a place to stay. So he controlled the money. And then her son was, I think she said it was around 16 years old. Her son was trying to get a job as well, but her boyfriend at the time stopped that. He would give him bad references. He would call the place that he would apply at, and he would just keep him from getting any of those positions wherever he applied, to the point where her son ended up getting so angry at her abuser that he would tell her that he wants to get a knife, wants to get a gun, just so he can hurt the ex-boyfriend. So it was taking a toll on this kid as well, on her kid. It was taking a toll. And once she finally figured, like, you know what, I do have to seek help. I need to find resources for myself. She said she started off with a food pantry because she was highly dependent, like I said, on his financial income. She had none, so she went to a food pantry, and the first few times they gave her food, but after like third, fourth, fifth time, she said she went in, and the staff found out that she used substances. So one of the staff members there told her, we can't give you this food because we know you're just gonna sell the food, sell the groceries, and you're gonna use that money to buy yourself some drugs. So then and there, that organization completely lost this lady. This lady who was constantly just coming to this facility just to get food stopped going there because she was seen as she was nothing just because she used substances, and she was trying to better herself, but she was immediately just shut down. After that, would you want to return to a place like that that automatically judges you like that? And we're going to talk about some situations as well where it isn't the victim's fault that they started using substances as well, because we can't be so quick to judge a book by its cover when it comes to that. And that's one of those things, one of the things that we can do to help reduce that stigma is just not judging. It's one of those things, but we'll talk more about that here in a bit. And I just noticed I didn't have my story time screen up, but let's define stigma. Stigma is defined as a set of negative and often unfair beliefs that a society or group of people have about something. The way you see that when we're talking about domestic violence victims or substance abuse users is stigma is a mark of disgrace that sets a person apart from others. When a person is labeled by their illness, they are no longer seen as an individual, but as a part of a stereotype group. And this is exactly what happened to this lady that shared her story with me. And she was very reluctant now to attend treatment at a substance use facility where she could start her recovery. She was not going to go there anymore. She felt like the whole world was going to judge her just based on this one experience she had. So when maybe it's not an organization you work with or someone you know that stigmatizes an individual, but they might hear something while they're walking down the street, and that little thing is going to take a toll on them that's going to stop them from seeking those services. So it does have a real impact on clients and victims when they're affected by it, and when they're stigmatized. It really does take a toll on them. And it reduces the chances that they're going to seek those services like harm reduction as well. So we're going to be talking about supervised injection sites. We're going to be talking about syringe exchange sites and safe smoking kits, because there's all these services that are out there to help these clients, but there's such stigma just clouding those services. So, and we'll talk about that here in a second. But substance abuse, what is substance abuse? Substance abuse is a disease that affects a person's brain and behavior and leads to an inability to control the use of legal or illegal drug, medication, or substances. Legal, this is what you see in pharmacies, over-the-counter medicines, cough syrup, antidepressants, alcohol, and these are what's seen as your legal drugs. But then you also have your illegal drugs, which is more on heroin, cocaine, meth, fentanyl. And there's even stigma within the substance abuse community, because you'll have individuals that'll tell themselves, well, it could be worse. At least I'm just drinking alcohol. At least I'm not like this person over here in the alley that's shooting up heroin, doing cocaine. So there's stigma within those subgroups on their own. And then the same thing for an individual who might be snorting one of these drugs. They'll have that same stigma towards the IB users, the ones who use those syringes. It's like, well, at least I'm not shooting it up my veins and putting myself at a risk of infection from HIV or Hep C. So it's all these stigmas that surrounding that substance use. And at the same time, when it comes to this, the stigma of those drugs and the drug use, just because someone uses a drug, does that make them a bad person? No, it doesn't. They're not bad. They're not evil. Does it make them worthless? Of course not. Does it automatically mean that they're homeless? No. But these are things you hear, that stigma that's tied with that substance abuse. And another one of the things, one of the more common things is that they hear is they're uneducated. Because if they knew the harms of substance abuse, they wouldn't do it. So they're clearly uneducated, and it's just constant. When they hear that tears down people, that tears down their will to seek those resources. But when you hear it at those facilities, again, it's just them constantly hearing negative, and it does take a toll on these individuals. So let's move forward towards domestic violence, and that's its definition. Domestic violence is any behavior that purpose of which is to gain power and control over a spouse, partner, individual, or family member. Abuse is learned behavior. It is not caused by anger, mental health problems, drugs, or alcohol, or other common excuses that are used. And that's one thing I wanted to stress here, that just because an individual is using alcohol or substances, that is not an excuse for the abuse. Just because substance abuse is in the picture doesn't mean that domestic violence is gonna be the result, because there are abusers out there that use substances, but they aren't physically abusive, they aren't emotionally abusive. It's just they abuse a substance. There are individuals out there who are abusive like that in those ways, physically abusive, but they've never touched alcohol, they've never touched a substance. So it doesn't mean one causes the other. It's another thing we wanted to make sure to clear up in this situation. And then we have the link between domestic violence and substance abuse. I have these up here for you, but the main thing I wanted to touch on is, yes, they are a common pairing. Usually when you see one, you're likely to see the other form of abuse, because according to the American Society of Addiction Medicine, victims and abusers are 11 times more likely to be involved in domestic violence incidents on days of heavy, that's a typo right there, heavy substance use. But again, it doesn't mean that just because substance abuse is in the picture that it's going to guarantee that domestic violence is going to occur. It's just like, let's say I had the flu and I also had a broken leg. Does that mean that my flu caused my broken leg? No, of course not. And does it mean if I treat that flu, if I treat those symptoms and I get medicine for that, and I get the flu taken care of, does that mean it's going to solve my broken leg? It's going to fix it? It's going to heal it? No, of course not. So just like substance abuse and domestic violence, they each require their own form of treatment. Maybe organizations that are out there aren't equipped to help individuals in both aspects, but that's why connections with other facilities and organizations work. You can refer them out if you work in a substance abuse facility and you know this individual needs domestic violence assistance, they need shelter. You can make a referral and you can make those connections, and we can work together to help our community improve, to help get some of these victims out of the situations that they're in at the time as well. So it's one of the connections you see, but those abusive conditions are just very hard for an individual to deal with. This is one way that substance abuse can make the connection with the victims. Like, okay, if I'm constantly being abused and everything hurts and I need some pain meds, and I know that pain med can relieve all the hurting, all the aches and everything, then yes, some victims will turn to those opiates to help them relieve them of the pain, even if for a few hours. They know it works. They've heard of people telling them that it relieves the pain, it stops all the hurting, so they turn to that. But we're going to talk about more about that here in a second. How is stigma harmful to victims? Number one, turned away from resources that they may need. If it's simple food pantry and they're turned away, like the story I just shared, that's one way. It reduces their ability to leave, because who are they going to turn to? They don't think anyone believes them because they use a substance. They don't feel like they're credible enough because they've heard it constantly that now you're untrusted. Like, I can't trust you. You're a drug abuser, so I can't trust that you're going to change. So why on earth would I help you? And these are things that they hear. That stigma of how substance abuse and your past, that can be used against an individual, because you see employers frown upon on that, and for right reasons. You don't want anyone working in your facility that's under the influence all the time or anything, but that history and that the stigma there can be used against them, and it keeps them from pursuing financial situations or an employment where they can get financial situations, because they know they're going to fail that drug test, and they know that the moment that the employer sees that they failed that drug test, they're automatically disqualified. And that's not all that's not true in all cases. It depends on the employer, but the way these victims see it is, yeah, automatically disqualified. So why on earth am I even going to try? And it just helps the perpetrator in that aspect, because it's keeping the individual at the palm of their hand. They're being able to control them and keep them in the situation that they want them in. So again, this stigma is very harmful to the victims, and it's only helping the perpetrator continue the abuse and helping them keep that control over this individual. Same thing with CPS. Let's say or CPS and police officers. Let's say the victim wants to call the police officers to come in and arrest the perpetrator for being physically aggressive. Well, their thought process is now going to be, well, if I call the police officers and they see that I'm high, they're just going to arrest me. They're going to call CPS and remove the kids. So why am I going to take that chance? So it's all these barriers that they have to overcome, because they're constantly hearing this. Now, you're the bad one here in this situation. Drugs are bad for you. So that stigma just weighs on their shoulders, and they're seeing it constantly. Now, like I said, I like to use personal stories, and I like to use interest when I'm delivering these presentations. So this one right here, I don't know how many of you have seen or heard of X-Men, but it's one of my favorite series. I saw this growing up as a kid a lot. But for those of you who may not be aware, there is a protagonist in the movie named Wolverine, which is the individual here on the right, which is our victim today. And then you have the antagonist, which is Magneto, which is the one on the bottom left here, the abuser. In this certain clip, I wanted to get this clip to show you, but it was way too long. But in this clip itself, I wanted to make the comparison, because Wolverine is very capable. So our victim here is very capable of leaving the abuser. And in the movie, he's overcoming obstacles, which are all this cement blocks and the cranes and police officers that are in the background and enemies. He's avoiding all that. So that the reference I want to make with that is that's all the negativity that these clients are hearing about on the daily. But then as the movie progresses, we find out that Magneto can actually control metal. So that metal represents the control that an abuser has over their victim. And he uses those in the movie. He uses those metal bars and metal rods to insert them over Wolverine's body, so he can control him as he pleases, so he can manipulate him, so he can move him around as he pleases. So this is the way these abusers control their victims, by finding what works against them and taking full control of them. Now, all those barriers that were around Wolverine that he had to worry about, like the police officers, like the negative comments and all that, those are little fragments of stigma that these individuals, that these victims have to also think about when they're seeking help. So it's not just as simple as point A here is where I'm at, point B is where this facility that's going to help me is at. If it was that simple, they would initiate that plan and get help and assistance they need. But when they're hearing that stigma, it distracts them from their main goal. They're hearing constantly, so they lose focus on what their ultimate goal is. So now the focus has changed to, well, I don't want people to judge me for this. So you know what? I'm just going to isolate myself. I'm not going to put myself out there. Why put myself out there in front of a facility, an organization, or staff members, or just other people in general that are going to judge me based on my past, based on my current substance use? So it just, when it comes to stigma and eliminating how many barriers, how many loops these individuals have to jump through before they're able to get that help, is very vital. That's why, like I said, it is very important to talk about this topic itself of stigma and substance abuse, because they are connected. When we're able to eliminate those unneeded concerns of stigma that these victims have to go through, the better access they'll have when it comes to seeking those resources. But when it comes to why someone abuses drugs, especially with our current situation right now when we're going through COVID-19 and numerous people losing their jobs and unemployment skyrocketing. That takes a toll on the individual as well. And just like it was hard for individuals or the victims to seek resources during the stay at home uh, situation, it was hard for individuals who had a substance abuse disorder that had to go to methadone clinics for them to actually access to that. Like we all had to adjust to that, but these victims that had to go to receive that treatment are also affected, and it takes a toll on the individual. Again, it takes a toll on them. So you add on top of that a loss of a job. Yes, that's probably a reason why someone would turn to substance use. But then you have trouble in their relationship, in their marriage. It's another one thing you see, because it starts that back and forth between the abuser, between the victim, and it just keeps it going to the point where, you know what, the victim is tired of that, just wants to relax, and might just use marijuana as a coping mechanism, or just to relax, or just to set the situation aside and forget about it for a minute. So there's different reasons why someone would use a substance like that. But self-medications, that now, it's insane how readily available a lot of these substances are. I shared in my previous webinar that I did, I shared a story where I went to the dentist a few years ago because I had to get 3 of my wisdom teeth removed. And the dentist, he offered me some pain medications just to help me. And I was picturing, oh, you know what, I'm probably going to get like a week's supply. And he sent me home with a prescription for 2 months worth supplies of painkillers. 2 months, which is ridiculous. There's no way I needed 2 months worth supplies of painkillers. And what could I do in that situation? I mean, yes, I don't have to go in for my second refill, but now on my first refill, I had access to 30 pills. That's a lot of medication. And if I only needed 3-4 days worth of pain relief, and then I put them in my medicine cabinet, who has access to that now? Anyone in my household could just go in there. So it is just easy for individuals to have access to those medications. But we'll talk about that here in a bit as well as we move forward. Excuse me. So I'm mostly gonna focus on the opiates today, just because there's a number of different substances. But since we are going through a opioid crisis currently in the United States, I'm gonna make that one the focus right now. Now, Percocet is one of those opiates that is actually, I'm not sure how much it is used now after C-sections. But a woman who has given birth, they were usually sometimes offered Percocet as pain relief. So that's one way those opiates can be introduced into someone's daily life. Morphine, used before or after surgery to alleviate severe pain. Codeine, mild to moderate pain. Oxycodone, moderate to severe pain. You have Vicodin for wisdom tooth extraction. You got fentanyl, just for treating severe pain in cancer patients. Yeah, now this one I have a hard time actually pronouncing. Carfentanil, I think it is. That's how it's pronounced. But this is used as a tranquilizing agent for elephants and other large mammals. Now, I have a video here I'm going to play in a second. But fentanyl, when I was doing my CPR training and first aid certification, I had one of the trainees tell me that one of their partners was responding to a very bad incident on the highway where it was just a crash. Someone ended up getting T-boned, and they responded. They ran into the car. They opened the doors, and this individual ran in there, and he pulled the individual out of the car. He pulled him out, and there was smoke everywhere. There was dirt just everywhere. So he pulls out this individual, and his partner ended up falling to the ground afterwards, and they didn't know what was wrong. They didn't know why he was feeling ill. And it turns out that inside that car that he pulled out the the individual from, he had drugs in his car. He had a lot of fentanyl just in the passenger seat, and it was scattered all over. And the first responder wasn't wearing any gloves, so he had made contact with the powder and the pills, and that alone was enough to cause harm to this first responder, because fentanyl is 50 times stronger than morphine itself, and it's highly addictive. And if you have like an open wound wherever that point of contact comes into play, that alone can cause severe physical pains, and it can even cause addiction on that alone. And then the next one, carfentanil, that one is about 100 times stronger than fentanyl itself. And I mean, I don't know how many people would have access to that, but it just to paint the picture of how strong these medications really are when it comes to the harms that they can cause. But I'm gonna play this next video for you, and it's gonna touch a little bit more on fentanyl. It's gonna talk about the situation that happened.
Kristen, we're told a Cincinnati police officer was looking through a car, looking specifically for drugs when he touched something like this, a powdery substance. Now that officer is okay, but doctors say things could have been a lot different.
We've always had to worry about getting attacked, shot, stabbed, hit, kicked, whatever.
FOP President Sergeant Dan Hills says there's now one more thing to add to that list: illegal substances like fentanyl or carfentanil.
My mind is in a place where yet another danger that we're going to have to be thinking of.
Police say the officer was at a traffic stop in Cincinnati's District 1 when it happened Tuesday. After he went through the car, the officer said he was feeling sick and lightheaded. He was taken to the University of Cincinnati Medical Center. Dr. Dustin Calhoun says even small amounts that are absorbed can be problematic.
Where on your body they touch, how moisturized is that skin, is there a crack in the skin like dry skin on your hands or something like that? Does it go in, it goes much faster if you breathe in a little bit of the powder.
And Dr. Calhoun says that's when things can turn deadly for first responders.
That's the biggest thing we're talking about here, is you get enough of this stuff in your system fast enough, which can happen with just topical skin exposure, and you slowly stop breathing. In a matter of minutes, that person has permanent brain death.
Sergeant Hills says he's afraid these types of incidents are only going to get worse.
I think it's going to require more training, more gear, and one day I can see where officers will more routinely just wear gloves.
So it's just
Kristen, we're told
it's just a situation that you see of an individual doing their work, doing what puts money on the food on the table for themselves. You have that situation, police officer just doing a drug search and the harms it caused. I shared the story with the first responder that was helping this individual, getting him to safety, and the harms that it caused. And again, it can cause that dependency at no fault of their own. They weren't out there actively searching a high. That's not what they were doing. They were just doing their job, and they were exposed to that opiate. And again, that's another way that it's introduced into just an individual. If you had that abuser, or the victim rather, that was putting up with all that abuse, and then all of a sudden they have access to some of these painkillers because they went to the dentist and they have those painkillers readily available, it increases. I mean, that's another way that they get access to those opiates, and they might turn to them, they might cope with it, because they might remember how it made them feel. It's like, you know what, this numbed me. This put away all the pain, everything I was feeling, it just set it aside. So I need that again. And it could push them into actually going down that route and just digging deeper into that rabbit hole. Now, Naloxone is another important one I wanted to make sure that I included in this presentation, because Naloxone is sold under the brand name Narcan, among others, but it is a medication used to block the effects of opioids. It is commonly used to counter decreased breathing in opioid overdoses. So this is a life-saving medication for individuals who have overdosed, and it can be administered through a nasal spray or through syringe. And this is there's a stigma behind this as well. And this is, again, this is medication that helps individuals in an overdose situation. If you were to go to a pharmacy and you were to ask for naloxone, you can go about that route. You can talk to your doctor about it and get it prescribed. But in most situations where an individual doesn't feel comfortable talking to medical or healthcare workers in situations like that, because they're afraid they're going to be judged, and they keep information like that from their doctors that could prescribe a medication like this, it again, that stigma behind it affects them, because now, instead of having access to this medication, I'm not going to ask the pharmacist or the nurse for this, even though I know it can help me. But I'm afraid of that, the stigma behind it, how you're going to look at me. Who are you going to call? Are you going to call CPS? Are you going to report me because I brought up naloxone, which means either I'm using opiates or I know someone that's using opiates. So they're afraid of all these questions that are going to come when that arises. So that's another one of those stigmas behind that. And at the same time, the healthcare worker, that nurse, that pharmacist, or the doctor himself or herself, they don't want to bring that conversation up. They don't want to say, hey, I see you have those track marks on your arms. So is it okay if I recommend that you use naloxone? They don't want to throw themselves out there like that and be the ones to make that judgment call, again, because of this stigma. Because how's that going to look when we bring up that conversation with patients? And it keeps that vital life-saving medicine from individuals that could benefit from it, and all due to stigma itself. This is one of the quotes that I saw from the National Center of Domestic Violence, Trauma, and Mental Health. The drugs are an element of control. If they can keep you on the drugs, using or addicted to drugs, they're in control. And it's like strings on a puppet. They just keep you under control because you want that other hit, you want that other drink. And that's basically what we see with the substance, with victims who use substances, rather, because the perpetrator can see that, and they can use those substances to control them. If it turns into physical abuse, they can easily take away that substance and cause withdrawal symptoms, which can be very extremely painful for the person going through that. But we're going to talk about that here in a bit, because that substance abuse is a very powerful form which victims can be controlled by their perpetrator. Like strings on a puppet is what it is. And we're going to talk about some of the forms of control. And when it comes to substance use, introducing partners to drugs. Sometimes we've seen cases where the abuser is actually the supplier to the victim. So they start them off with simple, you're not as strong or potent drugs, and they slowly start like, well, maybe you should try this, maybe you should try that, and they force them to try some of the heavier drugs and substances just so they can get them addicted and then take complete control of them in that aspect. You see coercing partners to engage in illegal acts. So they force them to exchange sexual activities for substances from other people other dealers. They sabotage recovery efforts the moments that they see, oh, this individual is clearly bettering themselves, they're trying to get over it. Now, you know what? We're going to change that. We're going to up the dosage on something that they're taking and purposely stopping them from getting clean. They sabotage them, and they know that because they want to make sure they maintain that power and control over this individual in that situation. Blaming abuse on partners' use and benefiting from it. But that's another thing, another form of victim blaming that you see, just accusing them. It's like, it's because you use these substances that you deserve this punishment, because a good person wouldn't be using this punishment. So I'm going to treat you the way you deserve to be treated. Again, just adding on to that stigma that you deserve this, that substance use is bad. So you're a bad person as well. And anything you've done from here on out deserve this kind of treatment from me. So these perpetrators are very smart in that tactic and how they use that substance use that a victim is going through against them and to control them. But you see, it's just a very powerful tool to use that relapse when it comes to a victim when they're trying to get clean in that situation. And we're going to talk about some different forms that how you see substance abuse and the different forms of abuse. And like I mentioned earlier, that physical abuse, you could see that from withdrawals and removing the drug from the victims and causing those withdrawals and making them have to go through those relapses. And emotional, you see that where, well, who's going to believe a junkie? If you call the cops, are they going to believe me or you? So they start taking a toll at their self-esteem with that and emotionally abuse them as well. When it comes to sexual abuse, you see that in the form of having their partner exchange sexual services for drugs as well. Verbal, calling them derogative terms, junkie, crackhead. And again, those are a lot of the terms that you hear. And we're going to talk about what proper language as we get further down. But those derogative terms, again, they take a toll on individuals that are going through that. Financial situation as well. We talked about sabotaging someone's ability to get a job, or just by calling in and putting in bad reference, letting them know that they use substances, and forcing them to not actually get a job, just sabotaging that. Digital, using recordings of the victims using or during their high and using that to blackmail them, using that to threaten them to take to CPS so their children are removed, or maybe taking it to their place of employment so they can lose that job, and now they're going to be financially dependent on the victim. So you see the ways that substance use is used to inflict that domestic violence when it comes to all different aspects of it. And then when it comes to an individual that is going through opiate dependency, and again, the reason I'm focusing on the opiate is just because of the current crisis that we're going and how much of it has been widespread through the United States. But the withdrawal timeline with someone that has trying to recover from that doesn't happen overnight. In best cases, that'll take about a month, in best cases. But realistically, you're seeing a few months of an individual having to constantly go through some of these withdrawals, especially if they relapse, if they have that abusive partner who's forcing them to get back on it. No matter whatever the situation is, it takes a while. Is what I'm trying to get at when it comes to them getting to the recovery status when they're actually sober. And so this one's actually supposed to be a further down, but since it's here, we're going to touch on this. One of the resources I actually had is a medication disposal program. Now, depending on where you live, you might just have to search it up. And I live in Irving, and in Irving here, we do have one of these disposal programs. And right here on the bottom right, where you see this, the third, they have that drug drop-out box where you can bring any of the extra medications that you have and you no longer need. You just bring them there, and they get taken care of. Because a lot of people say, well, we can just flush them, can't we? And yes, you can, but it's not recommended. It's recommended we go about it the proper way. But this is one of the resources I had that's just out of place for now, but we'll move forward. So when we're talking about methadone, this is an alternative for individuals who are actually trying to break that addiction that they have, that dependency that they have to the opioids. So methadone is a prescription medication that works in the brain to treat pain and dependence on opioids. Methadone is in the same family as opioids. Its long activity in the body makes it suitable for reducing cravings for other opioids and easier to taper a person off of these substances. It is important to combine methadone treatment with counseling and other support. So this is the reason why some of these facilities, because methadone clinics do carry a stigma behind it. And we'll talk about that here in the next slide. But clinics and facilities like this link individuals that are going through situations like that. They link them to care. it's not just you're coming here, you're receiving methadone, and then you're out the door. They have access to counselors, they have access to social workers, they have access to resources. So when they're ready, they're able to get those resources that they need. Oh, you need help finding shelter? Okay, we can just refer you out to this facility, or that maybe they have someone in-house that has connections already that can help them with that situation. But it starts that linkage to care when it comes to victims that otherwise wouldn't seek out these forms of treatment on their own. But again, there's so much negativity tied to a lot of these organizations and facilities that are there to help victims going through substance use dependency. Now, when it comes to methadone clinics and stigma, you see a lot of those stereotypes when it comes to the individuals that are in there. It's like, oh, they're untrustworthy, they're heroin junkies, incompetent, they lack willpower. Methadone's just another way to get high, and it affects these individuals that are out there going to seek that treatment. Because when at a previous job that I was at, a lot of what I had to do was, I was part of the education department as well, where I was focusing on HIV and STIs, and I would go to methadone clinics at 5 a.m. in the morning till 9 a.m. and we would focus on proper ways of harm reduction, because substance use was going to happen regardless. So instead of letting them just figure it out on their own, we were there to educate them in that aspect. We were there to help them with HIV testing, with Hep C testing. So these organizations were bringing in educators and just resources from the community to help these individuals in those situations as well. Because, sorry, so they just these clinics themselves receive so much negativity. There's like, why are we using tax dollars to supply some of these services to these individuals? But it's just really important, because it's not just methadone treatment that they're receiving. They're being, again, linked into other services that they aren't going to seek out on their own. But 78% of people undergoing methadone maintenance treatment have experienced stigma. So that's an extremely high number of individuals of hearing these constant negative remarks in one way or another. So I have this quote by one of my favorite artists called Nikki Sixx. He was the bassist of Motley Crue, but he ended up turning his addiction story into a book, later into a soundtrack, and then after that into a Netflix movie, The Dirt, which is extremely good. But it shows you what that addiction looks like from the inside looking out, because he did document everything. But there's one quote in there that really stood out to me, which was, "Addiction is horrible, but suffering in silence is worse." Now, when I read that, when I was going through that book, it just hit me. It's like, so you're isolated from any resources, right? But at the same time, if you're not out there trying to seek those resources, nobody knows that you're suffering. Nobody knows what you're going through. So how can we help you if we don't know what you're going through? And if we're stigmatizing all these individuals because of their substance use, they're just going to stay quiet. They're not going to seek out those resources. And just like Nikki Sixx mentioned, they're just going to suffer in silence is what it comes down to. So erasing that is very important. Now I see I'm slowly starting to run out of time, so I'm going to push ahead of here a little bit. And I'm going to touch briefly on supervised injection sites, because these have been blowing up all over the place except in the United States. They have been very effective. What these are is they're supervised injection sites, which are medically supervised facilities designated to provide a hygienic environment in which drug addicts are able to consume illicit recreational drugs by IV. The legality of such facilities depends by location and political jurisdiction. So you have medical professionals there. Essentially what it is individuals come in and they use their substance, but they get clean syringes. They're supervised just in case an overdose occurs. And they've been active for about 30 years. They started off in Switzerland, and there's some in Canada, and again in Europe. And there's a current facility or a nonprofit organization that is actually trying to get it started here in the United States in Philadelphia called Safe House. and they're trying to provide those services, and they're trying to link these individuals to care. They have those resources ready, because in the millions of people that have used these facilities to use those drugs, there has been 0 overdose deaths coming as a result from that. And it has shown that there's been no increase in crime. If anything, it's been helping decrease crime. It's been helping decrease the number of individuals who end up contracting HIV or Hep C due to improper use of syringes or using dirty syringes. So it's just very beneficial for communities out there to haven't been shown to work in that situation. But I had a video here, but we're actually going to skip that because that one's a bit long and it won't give me enough time to cover the rest of this. But you also have syringe exchange sites. And 1 in 23 women, 1 in 36 men who use IV drugs will contract HIV. And this is another thing that can be used against individuals by their perpetrator. Their HIV status, if they turn out to test positive, the individual can use that to hold against them. It's like, you know what, you're going to leave me? Well, I'm going to tell everyone you're HIV positive. And it keeps this individual in that relationship from wanting to leave because, yeah, now I'm being threatened with my HIV status. And here are a few of them that are actually here in Texas that I found while I was looking at them. And the closest one to ours is actually to here in the DFW area is OD Aid, which is in Fort Worth. And it does just that. It helps individuals when it comes to sort of reducing harm reduction is what it comes down to, harm reduction, so that they stop the spread of HIV and Hep C and administer some of the substance use in a safe environment. And then you have Austin, you have this, it's essentially a mobile bus, which helps with, it helps link individuals to care that they may need, but it also offers those safe syringe exchanges. It helps them in situations where they might need proper overdose prevention, how to use Naloxone, how to get access to Naloxone. So it helps them in the situations that they have a whole schedule where it's like a food truck, essentially. They'll post a schedule, this is where we're gonna be here for X long, and then the next day they do it all over again. So you can see some nonprofits are out there actually trying to provide those services for these individuals. So I wanted to cover this fighting back against stigma before we wrap up, because I believe this is very important. But people report perceived stigma for healthcare providers, loved ones, and general public. No matter the situation, no one likes to feel judged or devalued. In order to encourage people to reach out for help and to get on path to recovery, it is important to reduce the stigma surrounding their situation. Educational programs and modeling for non-stigmatizing behaviors can help people provide non-judgmental, empathetic support. And now how do we do this? By, again, offering that compassionate support, believing individuals when they come to you with a situation like that, and not judging them. Just not judging them alone is vital when working with an individual that is currently going through a substance use dependency. Displaying kindness to people in vulnerable situations. Again, not taking advantage of them, not just turning them around. It's like, no, you deal with this on your own. No, just be kind in that situation. Listening without judging. Seeing a person for who they are and not the drug they use. Because yeah, they're not a substance. They might use this, but again, that's not what defines them. Doing research, learning about drug dependency and how it works. And again, learning that maybe it wasn't their fault that they ended up dependent on that substance. Not everyone who is dependent on substance turned that way because they were trying to get their next high. Treating people with drug dependency with dignity and respect, again, another very important one, because the moment you start treating them without dignity, you've lost them. They're not going to come back to you and seek those resources whatsoever. Avoiding hurtful labels like junkie, crackhead, those derogative terms, those are some things that we're really trying to avoid. Replacing negative attitudes with evidence-based facts, speaking up when you see someone mistreated because of their drug use, sharing your own stories of stigma, just letting them know they're not the only ones that are facing that stigma, but at the same time, just letting them know they're not alone. and finding local resources that they can use, whether it be methadone clinics, STI screenings, which are sexually transmitted infections for like HIV, Hep C, domestic violence agencies, or substance abuse agencies that they might not be aware of, but having that in your arsenal so you can help them when the individual reaches out is very beneficial. And we're going to talk about, right before we wrap up, some of the terms that are very stigmatizing to individuals with substance use disorders, and what we can say instead. What's the proper way we can go about addressing those. But addict, one of the most common things you hear, instead of saying addict, switch it around to a person with a substance use disorder. And if they're currently, their disorder is marijuana, it's like, has a marijuana use disorder, instead of, no, this person is addicted to it, because it does, again, it does take a toll on that individual. This person has an addiction. No, this person suffers from a substance use disorder. This person is an alcoholic. No, this person suffering from alcohol addiction. Now, in addiction, in this one, the reason I kept it on there was just because you hear that as well. You hear individuals leave the addiction on there, but no, it's like you want to change that. You want to make sure. Now, I think I'm seeing some chat boxes in here pop up, but for some reason I cannot see my chat. I'm having all sorts of technical issues, so I'm sorry that I can't access that right now. But you want to say, in those situations, a person suffering from alcohol use disorder, instead of saying he tested, she tested clean, they're abstinent of substance use. They got a clean screen, they're substance free. Oh, their test came up dirty. Oh, they're still actively using. So you want to make sure you use the proper terms in that situation, so you don't lose an individual at the moment you start making a connection, because that's the last thing you want. Someone has a drug habit. It's what you want to say. It's they have a regular substance use. This person is a drug abuser. It's a person who uses substances. Again, this one is not up there, right? But reformed addict or alcoholic person is in recovery is ideally what you want to mention. And so I'll just leave the list up there for you. But these are the terms we want to just be very wary about, because just like using the proper pronouns when we're working with individuals from the LGBTQ plus community, mistakes are going to happen, but we want to make sure you address those simple errors then and there, instead of just not acknowledging them. Because even when that error happens and you've made that acknowledgement that I'm sorry, I messed up, and you correct that, that's going to speak volumes to this individual that you're trying to work with and that's trying to seek services from you, or you're just trying to have a conversation with. It speaks volumes to them. Now, I'm going to have a list of some of the resources that I had, and I'm going to talk very, very briefly, because I know we're at 3:01 right now, but I'm going to talk very briefly on these. And LifeSave, and then you have KiteString and TechSafe. The Tech Safety app, these are all applications that individuals can download, and it helps in situations of stalking, in case they're being digitally abused. It helps on proper ways on how you can go about protecting your cell phone activity and all that. But then the KiteString, that one's more of an application if you're worried about somebody stalking you, because those forms of abuse, stalking can be seen as one. It gives a notification to your friend and lets them know if you haven't replied. So it sends out text to let them know that you haven't replied back to this application. But there's numerous different facilities here in the DFW area or that can help with substance use disorder. And you have those, you have LifePath systems, you have Homeward Bound, where they have outpatient and inpatient treatment, Metro Care Services. Then you have other facilities like the Recovery Resource Council, which does offer counseling one-on-one sessions, but it also provides harm reduction and education when it comes to STIs, substance use. So you have these organizations that are out there doing that line of work as well. And Dallas County Org, now this is one I'm very familiar with, the Dallas County Health Department, because when I had clients that would test positive, this is where I would go with them to get a confirmed positive or a confirmed negative, just to reassure that it was either positive or was negative. But if they had an individual that tested positive, they would also offer them treatment from there. So they just wouldn't tell them, okay, you tested positive, now you're on your own. No, they would make sure that they receive the proper treatment, and so they can control the HIV if it was an issue that popped up. So these are some of the services that are out there, some of the resources that are out there that can help individuals in these situations. And there are many, many other more that I wasn't able to actually list just because it was going to get too crowded. But for the most part, that is it for our presentation today. And I'm going to leave my contact information up here if you have any questions or concerns, because I am looking through my chat, but I cannot see it pop up. So if you have any questions, concerns, or you want to reach out, maybe something I didn't cover that you would like to see, please reach out and let me know. Again, I'm always learning. I'm always adding new material, removing material that isn't working in my presentations, and with feedback, I can always improve these. And just wanted to thank everyone for joining me today, for being here. And just a reminder, once you close out again, it's going to pop up an automatic survey. Just fill that out if you do need those CEUs. But aside from that, everyone, thank you so much for joining me today.